Welcome once more again, pregnant women. My name still remains Dr. Edwin Emeka Nwokolo. We are going to take another topic of discussion in this our series of health issues. And today's own is bleeding in pregnancy. Topic is bleeding in pregnancy. What is bleeding in pregnancy? Bleeding in pregnancy means bleeding from genital tract, simply for the vagina during pregnancy. In pregnancy, you have three sections or trimesters. Have first trimester, second trimester, third trimester. Have first 3 months, second 3 months, and third 3 months. Many different things, different situations cause bleeding in pregnancy during each of these three different months or pregnancy duration, and some of them can extrapolate into other aspects like those that cause first trimester can also be part of the causes in second trimester or in third trimester at times. So as we look at bleeding in pregnancy within each trimesters, then at the end we want to find out how we can prevent bleeding in pregnancy. Then as much as possible, because it can affect both the baby and the mother at the end of every pregnancy duration. It can even terminate the pregnancy before term. So now we're going to look at different causes of bleeding during pregnancy, each aspect of these three trimesters. So in the first trimester, first 3 months, bleeding due to implantation, we call it implantation shedding. And that first few weeks or few days when the embryo is implanted within the uterine cavity, trying to stabilize itself within the uterine cavity, burying so the uterine muscle, then there will be some reaction that make the uterus to shed as some aspect of its endometrium, leading to some what we call endometrial shedding. So the endometrium tends to shed itself and how to accommodate the ingrowing fetus, embryo. So then some people see it as sort of spotting. I want to also at least still emphasize that whenever a whenever a pregnant woman is having bleeding, the bleeding may look minimal, may be so much massive. But I want to let you know that I will advise you that please any aspect of bleeding in pregnancy, no matter how small how big it is, please take it serious. Don't say it doesn't matter, because in most aspects it may just be part of the process of pregnancy, normal process, or changes in pregnancy. But then some of them indicate pathological situation which you do not take for granted. So whenever I see bleeding, you feel misplaced bleeding in pregnancy, don't wait. Don't say I'll manage myself through just chemist or other this thing. Go to health facility where they can be treated properly. So apart from the implantation shedding, then what called cervical changes, that is the mouth of the womb called cervix. During pregnancy, it has to change due to certain reaction of due to a presence of the foreign body, that is the embryo in the womb. It has to change. During this changes, can make them to have bleeding from the mouth of the womb, that is the cervix. Also, some people have some cancer, like cancer of the cervix. That during that period, so in the place of pregnancy, they can make the woman to bleed more and more. So we not rule out cancer of the cervix and mouth of the womb whenever you have bleeding in pregnancy. That's why you should take proper care of yourself. Don't assume just like ordinary bleeding. Then when that is miscarriage, most women when they are pregnant, they not know so that during the first few days or within the first 1 month, when they just see their first menses, don't know that already pregnant. And some of them have experience miscarriage. Depending on the actual causes, maybe chromosomal abnormality or other causes of miscarriage. Miscarriage means simply losing the pregnancy at very early stage, so in our environment, say before the first 28 days or first 7 months of pregnancy. That is when you can lose a baby. Or miscarriage can be spontaneously or just without any obvious cause. Then infection. Infection can be a cause of bleeding during pregnancy. I say infection of the mouth of the cervix, mouth of the womb, that is the cervix. Infection of the vagina itself can cause you to bleed during pregnancy because of erosion, vaginitis, cervicitis. All these are a way you can experience infection during pregnancy. A patient that has something like gonorrhea or chlamydia or syphilis can also experience all this infection during first trimester of pregnancy. Then another is traumatic injury. A woman is pregnant, maybe for one reason or the other, she puts an instrument inside her vagina. Maybe some people that want to tamper with maybe the pregnancy and want to commit abortion using instrument. That instrument can injure the woman, the vagina or the cervix or the womb, start bleeding. So that can be a cause of bleeding in first trimester of pregnancy. Then another cause of bleeding in first trimester of pregnancy is what's called ectopic pregnancy. Ectopic pregnancy outside the normal uterine cavity, and not outside the normal confinement of the womb, that is uterine cavity. So this pregnancy can be in the abdominal cavity, that is inside the abdomen. This pregnancy can be along the tube. Common is along the tube. That the tube just like the pipe that connects the ovary to the womb, that is the uterus. So that pipe, that is called tube, most times the pregnancy can occur there. And when the thing, because of the small nature caliber of the lumen, the tube can rupture. From there start bleeding. It can cause it's an emergency situation. Then pregnancy also can cause ectopic pregnancy can cause within the ovary, from area of the ovary. So in all, ectopic pregnancy means pregnancy outside the normal uterine cavity, and most time ends up as a miscarriage, or not as a miscarriage, sorry, because as a bleeding per vagina through the vagina in the first trimester of pregnancy. Then so these are the common cause of bleeding in the first trimester of pregnancy. It is said that out of every 25% of pregnant women, or 1 out of every 4 pregnant women, they shall experience this bleeding in pregnancy between the first trimester and first 3 months of pregnancy. Then in the second trimester of pregnancy, second 3 months of pregnancy, the bleeding could be, as I say, can be a serious issue, can be a minor issue, can be neglected, but in all our advice that take every bleeding in pregnancy as a serious issue, because some of them are more than what is expected. Then in this second trimester of pregnancy, there are some changes within the placenta. Placenta, that aspect that connects the mother and the baby, not like the tissue or the part of the formation that connects the mother and the baby. In some, what's called placenta accreta, placenta previa, placenta abruptio. These are different abnormal location of placenta, or situation of what can happen to placenta and make a woman to bleed. I wouldn't like to go into detail about all this aspect, but for that aspect, a woman having this aspect of placenta abnormality can come down with bleeding in pregnancy. Then infection, as I said, even though it can occur in the first trimester, in this second trimester also cause bleeding in pregnancy in this second trimester of pregnancy. Then even some women can have their womb can rupture, uterine rupture in this second pregnancy. Those people that have previous cesarean section delivered by operation, that's cesarean section. Some of them, or people that have myomectomy, that have fibroid operation, as you enter the second trimester, as the baby is growing, it can cause the uterus or the womb to rupture, and when it ruptures, it causes an emergency. So uterine rupture can be a cause of bleeding in second trimester, or especially due to some nature of the uterine capacity. Then infection of the cervicitis, or vaginitis also can be a cause of infection during the second trimester of pregnancy. Also, first to mention that trauma or accident, if anything happens, a traumatic injury happens to the mother, it can also affect, it can extend down to the womb. I say it can eventually make the womb to rupture, anything, make the woman to start bleeding in the second trimester of pregnancy. Then this is about resistant immunization, other aspect of cause of bleeding in pregnancy, resistant immunization. They are incompatible. It's a pathological situation whereby the mother's blood group and the mother's blood group is quite different from that of baby's blood group. There is a reaction, cases of reaction that make the blood vessels to hemolyze within the womb, that make the bleeding can affect the baby or affect the mother to start bleeding. Then let's look at the third trimester of pregnancy. Take note that some of the things that cause bleeding in third trimester and second trimester can also be a cause of bleeding in the third trimester. It is said that 3 to 4% of pregnant women in the third trimester and last few months of pregnancy experience bleeding this bleeding during pregnancy, which will affect both the mother and the baby. One of the causes of bleeding in the third trimester, sexual activities. When with vigorous sexual activities, from the man, they can affect the cervix, or affect the vagina, so that can vaginal laceration, what's called coital laceration. So it can affect any part of the genital tract, which it can make the woman to bleed. Then iatrogenic is because that is being caused by somebody, not that actually from the mother, but the bleeding is caused by an individual tampering with the genital tract. For instance, like maybe some people want to remove the baby, or forcibly remove the baby from inside the womb. By pulling on the baby, the uterus may rupture, the woman may start bleeding. So these are the way you can call iatrogenic cause. Other iatrogenic causes can range from maybe somebody trying to put an instrument possibly, or any material being put inside the genital tract can cause that bleeding, or some people will go to unqualified personnel to deliver them. In that aspect, it can make us hot drip. Some people put oxytocin, which can cause too much uterine contraction, especially those that have previous cesarean section. You may rupture and the woman start bleeding, may end in catastrophe for the baby and the mother. So that's called iatrogenic cause. Then other causes of bleeding in pregnancy are like uterine fibroids, cervical polyp, or growth of some abnormal pathological growth within the womb. Fibroid is what most people know. If during the process of delivery, this fibroid can start bleeding due to manipulation, uterine contraction, and fibroid at this stage is very hyperemic and hyperplastic, a lot of blood vessels within it, so it can easily bleed. So it can be a cause of bleeding during pregnancy. Also, what we call polyp, or like abnormal growth within the cervix or within the uterus, can cause bleeding during pregnancy. Then labor itself can be a cause of bleeding during pregnancy. When the woman goes into labor, the labor has set in. First of all, what show you like a plug, mucus plug, sealing off the cervical os. So when that due to changes during labor, the plug can be dislodged. It will contain blood and mucus in it. So you can see this as a form of bleeding during pregnancy. Even some of them may behave with called heavy show, bleeding so much, think that something more dramatic has happened. So these are causes of bleeding during pregnancy. Even the abnormal placenta location, placenta previa, abortion placenta, placenta accreta, all these can cause bleeding during pregnancy, especially in the third trimester of pregnancy. Then some women who are hypertensive, who have hypertension, they, due to the physiological changes during pregnancy and also the effect of hypertension, they can start bleeding. It's one of the ways can draw attention that somebody is having serious situation as per bleeding in pregnancy. So these are causes of bleeding during pregnancy. So what are those symptoms a pregnant woman have when she's about to have bleeding during pregnancy, or a bleeding during pregnancy? obviously the symptoms that you physically see that you are bleeding. But at times, you can even be bleeding within your uterine cavity. You will not notice it because when concealed bleeding, you will not notice it. When that maybe you feeling low abdominal pain as in the morning. So what are those symptoms you can feel? Most time, the bleeding can come of spotting, just like small drop, spotting, called spotting. It may be it's an ominous sign that something sinister is happening within your pregnant uterus. So don't take it for granted. Make sure assess a doctor's intervention. Apart from that, then some women when they bleed profusely too much that they start feeling dizzy. Some of them may even fainting spell, or some of them go into unconsciousness. That's why that you are bleeding, or the outward manifestation of the bleeding, that the bleeding is serious. Then some of them are say you have utter consciousness, as earlier mentioned. Then you see blood means just like maybe light, slimy or utter. It's just frank blood, which may be free flowing depending on the nature or the cause of the bleeding in pregnancy. Then uterine contraction. Some women start having abdominal pain because the uterus may rupture or start contracting. So when in labor, they start having low abdominal pain, serious that they can't even control themselves. So these are signs that you know that you are bleeding during pregnancy. Then even before you go into labor properly or reach 9 months, maybe you take a second trimester of pregnancy, like you no longer feel the movement of your baby. You say, I cannot feel my baby again. Maybe there's placenta separated, like I say, through placenta previa, or placenta abruptio, or placenta accreta, increta pacreta. All these are different aspects of placenta abnormality that can cause a pregnant woman to start bleeding. When that happens, see that your baby, if the baby is not dead due to this occurrence, baby may go into distress. That may not feel the movement of your baby again. Most times, if your baby move about, kick you inside your womb, but when this happens, may not feel your baby move again. And also, these are the way you know that your baby's condition is not all that encouraging again. Some people, when they start bleeding, they feel like vomiting or vomiting obviously. Those are way. Then some women, when they know that they start knowing that their blood pressure is very high, hypertensive patient, and that aspect know that something may sinister, which may show that she's bleeding, and that bleeding is not what you take for granted. So next thing, what do you do as a pregnant woman to prevent any of this bleeding in pregnancy? Because prevention is better than cure. You don't prevent this bleeding, or as for if the situation progresses, may end in catastrophe for you and your baby. So the person that once you notice that you are bleeding, no matter the level of the bleeding, please don't go let me attend to access care on the parks. All these people are not well trained to handle bleeding in pregnancy. I mean what I mean, non-skilled birth attendant or non-skilled personnel or doctors. These people outside this category of health workers, please don't go with them. Don't say I'm bleeding. Then go to chemist and access care, or go to traditional birth attendant and take access care, or private health care center and access care. No, this bleeding warrant you go into a facility where you have presence of a doctor or qualified health personnel who will attend to you, take care of you. And when you go there, doctor will attend to you, or health personnel ask you questions, examine you, investigate you, and treat you properly depending on the nature of the bleeding, attend to you. So no bleeding, you say take it for granted. That is what you are going to do when you notice that you have bleeding in pregnancy, or likely going to bleed in pregnancy. Then please don't take it for granted that it doesn't matter. What you think that overlook may be a sinister, may result to sinister situation for you and your baby. So please don't go to such person. Make sure you go to doctor immediately for treatment. Doctor will look at you, find out the cause, and treat you as expected. That is it. If it's in labor, if you are in labor, doctor will take care of your delivery. If you are going to bleed, maybe your placenta are going to return, because some people, when they deliver, maybe the placenta will not come out. They have returned placenta and they start bleeding profusely. So that aspect is not what you go and manage with TBA or primary health care center. or traditional birth attendant. No, you have to go take that, assess your care in a social health institution. Then the treatment may also depend on trimester, first trimester, second trimester, form of maybe bed rest. Doctor tell you to have observe some bed rest, then give her appropriate treatment. Also, I want to mention that in some first trimester or early second trimester, some women have weak, the amount of the womb service is weak, that once babies will grow in there, the womb will open and they spontaneously expel the baby. They may be a cause of bleeding in pregnancy. So means that this bleeding or the aspect of it cause has to be taken care of in a hospital, not in a primary care center or lower kind of health delivery. So these are the what you do when you know that, or you're about to have bleeding pregnancy, or when you're already having bleeding in pregnancy. So how do you prevent this bleeding in pregnancy? Just I've already mentioned part of it. Present yourself to a facility to take care of you immediately. Proper facility where I have skilled birth attendant, skilled health personnel, especially doctors. Then don't rely on self-medication. Self-medication should be something that will cost the life of you and your baby. So please don't resort to self-medication, and don't try to access care from quacks. Access care from people who are qualified to take care of a pregnant woman. Then if you have infection be treated. You have like cyclize ourselves, cervical insufficiency, cervical insufficiency. The doctor will know what to do for cervical cyclize, what other things they do for you as early as possible, especially the first trimester or early second trimester. They'll start the cyclize for you. Then avoid strenuous work. Once you know that you bleed during pregnancy, please avoid strenuous work. Observe bed rest. If you know that after each episode of sexual intercourse, you have bleeding in pregnancy, you have bleeding, please, for quite some time, reasonable time, avoid sexual intercourse. Keep to yourself. Don't allow yourself to may end up in uterine rupture, may end up with death of your baby. Even at times may affect you, the mother. So please don't take it for granted. And I believe that take care of yourself properly. At the end of the pregnancy, you go home with a live baby, and you yourself, the mother, will happy, and your family will be happy with you. Thank you very much for listening to me or doing this discussion. At this stage, allow you to chip in your concern, question that's bugging your mind, so that you can appropriately answer them and get your feedback. Thank you very much for listening once more again. Thank you. So, touch.